I'm a career transition coach. A lot of my audience is going through some kind of transition in
Yeah,
their life. When it comes to transitioning out of clinical medicine, what advice would you give somebody? Like,
sure. That's a good question. And look, but for the record, for the audience, I'm not a physician. I'm married to a physician.
yeah,
That makes me an honorary physician. Probably 8 out of 10 friends of mine, close friends, are all physicians. Um, so you can imagine the conversations, right? But look, I think if you are working for a hospital, internal medicine, or there are many other opportunities out there. You can open an office. You still do medicine, but now you are the captain of your ship, right? You can get into aesthetics. Aesthetics is booming right now, as they say. It just and then the other thing was that the other day I was just thinking, I don't see many physician coaches but there are young medical students that are having trouble, and they probably have maybe a mindset problem, maybe,
mhm.
or a confidence issue. And imagine there was a program. I don't know, maybe there is one out there. I haven't looked, but I was talking to my wife about it. It'd be kind of cool if you did this. Like, you go and you know what? Here's my rates. I have a program with you. I go over it, and I can coach you. I can mentor you. I think that'd be something really incredible for physicians to do on the side or transition out of. I had one other one. I'm
I agree with that one. I think every medical student, I think every individual deserves a coach.
Yes.
But every medical student should have coaching, mentoring in order to guide them because there is a lot of stuff that is not taught in medical school and
Yeah,
residency that we learn through lived experience.
I agree. Another thing I would recommend is for doctors
Mhm.
to learn entrepreneurship or business management. I find most doctors that I've had friendship with and a communication with, they are good at one thing, and that's medicine, because medicine requires a lot, right? I mean, you know this
Yeah.
more than I do. But then they lack in other things. They lack in communication. They lack in financial management. They lack in, like, how to grow your money. I think some type of program, educational program, something that someone can come up with, that would be great for, say, hey, I'll give you an example. I know some doctors that come out of residency, they have, like, $300,000 in loans, but they go get themselves a Ferrari.
Mm-hmm.
Like, I
A
get it, man.
$1 million house.
Yeah, I get it. Look, I get it. You came out of medical school, you busted your butt, you dedicated your life, you sacrificed so much. But, like, to get to really to own a Ferrari, you should have a 500,000 in the bank already. You have no debt before you get a Ferrari. So I think money management will be a huge program for doctors. I think they'll buy into that.
Money management, I 100% agree with you, especially I can speak myself. I'm an immigrant, so I'm like the first generation who's making a six-figure salary, and
Hmm.
I don't know anything about money management.
Yes.
And I am sure there is so many others like myself.
Yeah.
So yeah, that's a challenge as well. So I agree with the communication skills being important. When I did my NLP certifications and studied communication deeply, how to establish rapport and how to communicate, how to use hypnotic language, all of that good stuff. I was amazed at how much I didn't know, even though I was a physician.
Yeah. Yes. I mean, I think, like, during my stroke situation, a lot of doctors came up to me, and the last stuff they're saying was like, "Dude, why would you say that to me like that?" You know what I mean? And I get it. Look, physicians they come with raw information, and they have to deliver it, right? And I understand that.
Mhm.
But what if we can someone can teach the physician, say, hey, instead of doing this, first you say this, you let the calm down, the guards come down a little bit, and then you deliver it. You know what I mean? There's ways to do it. And NLP is amazing.
Yeah.
I interviewed, I forgot her name, Moyuddin. She's in Lahore, Karachi, and she teaches an NLP. And I'll introduce you to her. She's amazing. we had this conversation, and she said the same thing she said, like, NLP helps everyone and anyone, lawyers, doctors, accountants, anyone.
Hmm. Yeah, there is many techniques in NLP that can be used on for your own personal development, and you can also use them with your patients, um, your audience, your clients as well.